Welcome to Dow Chiropractic and Acupuncture. I'm Dr. David Dow. Welcome to my exam room. And today we're going to talk about stress. Stress is the thing that most of the people are feeling all the time. It's taken away your enjoyment of life. You might get a little bit stressed and you're just not as happy, or you might get more stressed, and usually happy children laughing and running around a room might make you feel good, but if it's actually making your stress level go up, then you may have a stress problem. So we're going to talk about stress. What can often happen is stress can relate to injuries that you might have, pain issues, but actually can relate to damage to a part of your nervous system called the autonomic nervous system. And there's an area in your nervous system that has a calming effect on the body, and that's going to be in our upper neck or in our lower back, and those are where the strongest calming nerves are. So I'm going to talk to you a little bit about what can cause that kind of stress. So one of the things that can do that is called a subluxation. So a subluxation is basically when you've got a bone that shifts out of alignment and starts to put pressure against the nerves. Now, the only place that's really going to cause major issues for that is if you have that happen in your upper neck. And those are the most calming nerves in your entire body. But what happens when we get that stress and that bone shifts out of place is a lot of people will take medications that sometimes work so well that the person never addresses the cause of the problem. And if you never fix that cause of the problem, which could be a actual physical issue, then over time things can get worse and worse. So as far as the spine goes, we always start out with a nice healthy spine like this. We've got disc bone, and the disc is going to act like a spacer, make lots of room in there for the nerve. When the spine turns, we want to make sure these surfaces are nice and smooth. That's going to keep this nerve nice and healthy and fat, and this should be able to move around nice and easily. And what can happen over time is the spine can degenerate, maybe over 10, 20, 30 years. You can lose that disc space. There's not as much room for the nerve. We can have a herniated disc or a bulging disc putting pressure on the nerve. These pointy, rough edges can start to dig into the nerve, and the nerve can start to die. In those parasympathetic nerves that we were talking about, those are the calming nerves in the body. Those are mostly coming from the way upper neck, but they also can be coming from the lower back and the sacrum. So if you have neck problems or low back issues, that could be part of where your stress is coming from. Normally in the neck, this is the strongest calming nerves in the body. What we want is a nice big bucket of serotonin and dopamine hormone to help you deal with stress when it happens. But what can happen is when this gets injured, the bucket can start to empty out. You're going to compensate by using your adrenaline and cortisol, and we want a nice big bucket of that. So if a bear walks into the room, we have enough adrenaline to get away from the bear. But what can happen is when your stress levels get worse, that bucket runs out. And then when the bear walks in the room, if you don't have enough hormone to deal with the stress, you're just going to shut down. And we call that stress overload syndrome. So that gives you some ideas of how we can help you with stress. Patients love how the way we deal with that. Stay tuned for our next video. We're going to give you some tips and tricks on how to reduce your stress levels. And stay tuned, and we can help you get rid of those fast.